I think having lost 7 stone, I'd be happy and things would be great, and going from somebody who was overweight to being normal weight, or model weight, as I was told quite frequently, but that wasn't the case. I was very, very low. I'd done all this hard work and still hadn't really got anywhere. I was on less medication. I wasn't having to take 25 tablets a day. I occasionally had to take painkillers. I was sleeping a little bit better. I didn't have to use crutches anymore, but I still couldn't exercise. I had an awful lot of spare skin. As you can imagine, the 7 stone weight loss, there's an awful lot of skin, especially with the speed at which I did it. And I think, to be honest with you, I was probably more unhappy at this point than I had been when I'd been 7 stone overweight, which is probably something a lot of people can't comprehend. But I struggled. I struggled for the next 2 or 3 years. I didn't want to put the weight back on because I knew that moving around was more difficult, and I knew that I actually had more of a chance of removing compression from my spine if I kept the majority of the weight off. But I also knew that I needed to do something quite consequential, quite significant, about getting out of my eating disorders. I used to chew food and spit out the food into the bin, so I would taste it, but not actually consume any of the calories. It wasn't until I did my qualification in nutrition that I realised how bad that was. And when I look back at the other habits that I had, I realised that I pretty much ticked every single box. I'd say probably it took me 2 or 3 years to get my head around weight that I was, and to get my head around eating, to be able to maintain the weight safely. Obviously I had to put some weight back on. I found this very difficult. The mentality and the psychological side of it is overwhelming and very, very difficult to understand, in yourself, very difficult to explain to somebody else. Especially when you're somebody who's allegedly so intelligent. I have a degree. I can't be a stupid person, but it doesn't work like that. It's very difficult to understand. I guess the weight loss did trigger a part of my life that I could call a rebirth or something like that, because it did introduce me to nutrition and the effect that food can have on your body and the psychology, not only of consumption of food, but the types of food that you're eating and the effect that has on your mental state. I did a qualification in clinical nutrition as a consequence, and that's how I've ended up down this path, which I think is quite fortunate. Had I not gone through that period of my life, I wouldn't have found the path that I'm on now. Having been overweight and underweight, I think I've had every eating disorder that you could possibly imagine. So having an aim of being fit and healthy seemed like just an unachievable target at that point. Impossible is nothing. That was my motto. I'd overcome spinal damage, I'd overcome rape, I'd overcome bullying, I'd overcome a relationship that was violent and aggressive. So I definitely had to be able to get a handle on eating disorders and food, because compared to everything else, that was pretty minor in my life. Married in 2008, so I had a pretty stable weight by this point. It had taken me the best part of 2 years to get a handle on it. I still wasn't very confident. I still didn't like the way I looked. I can't honestly say that I'm 100% yet still. By 2010, I was in a much better place, and I had started to do core exercises and core stability, which was helping. It did help my back. It helped with the pain in my leg a little bit. and it gave me a little bit of confidence, but it did nothing physically to change or to tone or to do anything to my body from that point. And I was still extremely distressed by the physical appearance that I saw in the mirror. So I think everything considered, by 2010, although in my head I still didn't see what everybody else saw, I was stable enough with my weight to throw away scales. I decided that they became an obsession. I'd get weighed 2 or 3 times a day to check that I wasn't putting weight on, and I didn't really want to live my life with that amount of control. An inanimate object didn't really seem like a perfect reason to wake up in the morning. You know, I'd wake up to get weighed, and then I'd get weighed at lunchtime, and then I'd get weighed before I went to bed. And if I put on a pound, then it was pretty much the end of the world, to be fair. There was no logic. There was no logic to it. I had no idea how I was getting through every day. So throwing away the scales was a much more sensible idea. And to be honest with you, I haven't been weighed since 2010. So that's pretty much 5 years now, and my weight may have changed. It may have gone up. It may have gone down. I think I probably weigh more than I did then. But I think that's probably because I put a lot of muscle mass back on, which I'm quite happy about. I do like the fact that I'm getting stronger physically. I can tell in my job that I'm getting there. It's definitely easier to treat my patients. Some of my patients are big rugby players, and definitely you need to be able to haul quite a lot of weight around for that. But yeah, I know I'm physically changing, but I don't have any kind of record on a set of scales. So in 2015 now, this I suppose is the next part of the story. The story of the breast cancer episode. My grandma, his mother, had also had breast cancer. She'd had it when she was quite young. She'd had a mastectomy. And I decided to go to my doctor, not because I was worried that I had any lumps or anything like that, but I thought I'd better be in the system, so that I had a record for if I did find anything. Also realised that we had, although nobody was practicing in the family, we had Jewish history and Jewish ancestry, and Jewish history is quite prevalent. Certainly the Ashkenazi Jewish ancestry that we had was quite prevalent with certain types of cancers, breast cancer being one of them. So I went to my GP, and this would have been September 2013, and I decided I wanted to be referred to genetic counselling, just to discuss my options and my risk, and if it was worth having any kind of genetics testing, just to be on the safe side. I got a referral from my GP, which he'd never done before. He didn't really know how the system worked. Nobody had ever been to ask him about the situation. And I went to Leeds, to Chapel Allerton, and saw my genetic counsellor, a lady called Segura, who was great. She was really informative, and she talked to me about the risk and calculated my risk. Unfortunately, I think her exact words were that she'd never had anybody with such a high risk as myself. This did 2 things. I kind of was anticipating that would be the case, because having a father with breast cancer, I knew that, you know, if I had a gene in the family, that it was a strong gene. I wasn't surprised by what she told me at all. It didn't shock me. And I think by this point in my life, I'd had that many traumas psychologically and physically that I thought, well, you know, whatever happens, I can handle this. And at this point, I probably had the best support system, best support network that I'd ever had. So from there, she referred me back to my GP, who referred me to Breast Care Clinic in Wakefield.